Hey Penn State family, my name is Melissa Eilenberger. I'm a physician assistant here at Penn State Altoona in the Health and Wellness Center. Today we're going to discuss STIs, sexually transmitted infections. There are three main types of infections that you can get through sex: bacterial infections, viral infections, and parasitical infections. That's right, you can get a parasite from sex. So first I'm going to talk about the bacterial infections. The most common one is chlamydia. It's estimated in 2017 that 1.7 million cases were reported in the United States. The problem with chlamydia is that most people don't have symptoms, so they're passing it along and don't even know they have the infection. 90% of men and 80% of women have no symptoms with chlamydia. If you do have symptoms, that would include things like discharge, burning with urination, testicular or pelvic pain. In women, chlamydia can cause long-term damage. It can cause pelvic inflammatory disease, infertility, chronic pain, and even hepatitis. So it's something, this is a big reason why we really push getting screening often. Anytime that you have any exposure that you're just not sure about, it never hurts to pee in a cup. I'll tell you more about that in a minute. The next bacterial infection I'll talk about is gonorrhea. With men, you can get burning with urination, discharge, pain, testicular pain. And again, a lot of people don't have symptoms, and women rarely have symptoms with gonorrhea, but it can cause, again, pain with urination. It can cause a change in your periods, heavier periods or irregular periods, and again, it can cause pelvic inflammatory disease, and it can lead to infertility. It's uncommon, but it can cause infertility in both men and women. With chlamydia and gonorrhea, you can get rectal infections, throat infections, eye infections, things like that. There does not have to be an ejaculation for these infections to be transmitted, and they can be transmitted through anal sex, oral sex, vaginal sex. So these are things just to be aware of. Syphilis is the third bacterial infection that you can get through sex, and there is a 70% increase in syphilis in the United States since 2014. It can cause firm, round, painless sores, rashes, and it can progress to a lot of different symptoms. It's kind of known as the great imitator because it can cause all kinds of different things. So it's something that can be screened for as well. For syphilis, the testing for that is a blood test. You'd order it, you'd go to the lab and get, blood drawn. For gonorrhea and chlamydia, you just come to the clinic here and we have you pee in a cup, we send it away, and you get your results in a week. It's recommended that you abstain from sex until you know whether or not, especially if you're having symptoms, whether or not you're positive. And if you are positive, we would treat you with an antibiotic. All three of these infections get treated with antibiotics, and then we would retest you. And again, you want to abstain until you know that you're clear of these infections, because sometimes the antibiotics, there can be resistance against them, and it can just take a while until the infection is completely gone. Next, we'll talk about the viral infections that you can get from sexual intercourse. These are the 4 H's: herpes, HPV, HIV, and hepatitis. So herpes, there is no cure for that. There are medications that can decrease your symptoms and can decrease the transmission. Thankfully, the rates of herpes have declined in the United States in recent years, but it's definitely, a lot of people still have it. And you can have no symptoms with herpes and be passing it to people. You can also have symptoms such as painful blisters, body aches, fevers. And if a person does have herpes, but they don't have an outbreak of the blisters, they can still transmit it to their partner, which is something that is concerning. The CDC estimates that 1 in 6 people from the ages of 14 to 49 are positive for herpes infection. Now, there's some some confusion between oral herpes and genital herpes. You can get oral herpes in the genital region and vice versa. The testing for herpes is not very specific because we can do blood testing for it, but it can be difficult to know for sure if it's an oral herpes or a genital herpes, like where it would show up in your body. HPV is the #1 STI in America. There are 79 million people have HPV, and what that causes is warts, cervical cancer, penile cancer, throat cancers, things like that. Today, thankfully, there is a vaccine for HPV, and there's screening that we can do, especially on women. We do cervical screening on women once they turn 21. It's called a pap smear. And we screen for herpes for HPV and for cervical cancer. There's no cure for HPV, but thankfully, oftentimes the immune system can really keep it at bay from doing damage to your body. HIV is transmitted through exchange of bodily fluids, so that would include sex. I'm not going to go very deep into HIV, but there's no cure. Typical symptoms would be like fatigue, night sweats, flu-like symptoms, chronic diarrhea, things like that. And we do HIV testing here at the clinic. We do a finger prick and you get the results in 20 minutes. And then there's hepatitis that you can get, hepatitis B or C, which is a liver infection that you can get through sex and through other routes also. But that would include fever, fatigue, nausea, vomiting, abdominal pain. There is a vaccine for hepatitis B, and we do blood work. We'd send you out to get your blood drawn to test for hepatitis. There's various treatments available, but it does become a chronic condition. So lastly, I know you're waiting for this to hear about the parasite that you can get through having sex. It's called trichomoniasis. 70% of people have no symptoms, and it's really interesting for me to look at the slide and see that little parasite swimming around. It can cause vaginal discharge, irritation, burning with urination, and the treatment is a week of metronidazole, so it can be cured, but it is something to be aware of because it can be passed and you might not have any symptoms. So finally, I just want to say the CDC does say that the only way to avoid STIs is to abstain from sex. If you're not going to abstain from sex, definitely use a condom every time you have sex, any type of sex, or use a dental dam or whatever you need. Make good decisions about who you're with. Stay away from drugs and alcohol because that can impair your decision making. So just make good decisions, be safe out there, and get tested often. Thank you.
Melissa, I have a question for you.
Sure.
Can you talk about the vaccine and tell us what HPV means?
HPV stands for human papillomavirus. There's a vaccine, you might have heard of Gardasil, and it's a series of 3 vaccines that you receive over 6 months. And that does not cover every type of HPV, but it covers I believe it's the 9 most common types of HPV that are the high-risk ones.
Is it available at the Health and Wellness Center?
We have the HPV vaccine here at the Health and Wellness Center.
And can I use my health insurance for it?
Yes, you can.
Awesome. Thank you.
Yep.